good evening, and good evening to the viewers out there. This is yours truly, Dr. Luvuyo Bayeni, your host for Dr. B Talks. And yes, we bring you once again our live broadcast, which is a simulcast broadcast with Sowetan. Don't forget to follow us on Dr. B Talks page, Sowetan, as well as our YouTube channels, where you can also follow and subscribe. We must also apologize for the delay in terms of start, but we're here now. And we are so excited to be bringing you a very exciting episode. As you would know, this month we have dedicated the month to sports, exercise, and health. And please, before we continue any further, if you can hear us, you are with us, and you have joined, please just indicate with a thumbs up, the hearts, the claps, the hands, shakes, anything that you can press on your gadgets so that you can indicate that you are with us in the house. We would appreciate that. So yes, let's proceed. And as you know, this month we have dedicated the month to sports, exercise, and health. And we have kicked off the month with starting with mental readiness for competitive sport. And yes, last week we brought you another exciting topic, which was looking at school sport, where we were trying to empower, equip, and support those that are either participating in school sport or raising, supporting, and encouraging young athletes to participate in school sport. And I told you that I'm not going to be hinting or sharing with you who I'm going to bring this week, because I wanted to keep it as a surprise. Yes, some of you tried to help me decide or guess who it is, but some of you just ignored our game and did not want to take a chance. Yes, today let me just bring to the fore and allow my mentor, my boss, I usually call him my boss, but a dear friend of mine. I know him from way back as 2010, and where we were hosting the World Cup as a country, and Nelson Mandela Bay was lucky to have hosted 6 games of that tournament, including the third place playoff, which is quite a prestige game for the tournament. And I was working under his instructions as a pitch side doctor, which is an experience that one would never forget. Yes, let me welcome to the fore Dr. Konrad von Hagen, my boss. Yes, I always fail how to address you now in public.
But I think I need to start addressing you as the boss now, no?
Thank you very much. Firstly, thank you very much for embracing and gracing us with your time and agreeing to participate in this session. Dr. B Talks is a platform where we create conversations around health issues, but importantly for us, we always allow that people, whether they're in the healthcare space or not, we do believe that they, one way or the other, have got something that can benefit from our conversation. So we do allow that anyone can participate. It is not restrictive or catering only for those that are in the health space. So welcome, and maybe I did not do justice. I just spoke about you and how we met. Please do briefly introduce yourself as we welcome you to the platform of Dr. B Talks.
Oh, sure. No, thank you very much, Luvuyo. It's a real pleasure being here. So I was a 12-year-old and I was a good rugby player, but I wasn't good enough. And we had to write something in our year-end book. And I wrote as a 12-year-old, I want to be the Springbok doctor one day. So that took me a very, very long time. And I was fortunate to be part of the 2019. But I've had some fabulous teams that I grew up with and worked with in different sports. And then I think, last year being part of the cricket at Lords, where we beat the Aussies in the Test Championship. So I've been very fortunate to be in the right places at the right time. But I just think I put out good vibes as a 12-year-old, and it paid off later in life.
I think I would not want us to miss that part, especially for our viewers and those that are watching with their children. And the message for me is that when there is that edge that pushes you to say there is something about you, first as an individual, don't undermine yourself. 2, write it down. And 3, keep that dream alive. And you are a living example that if we do that, it does come to fruition and fulfillment. And like you said, yes, I used to even brag about you that I know the Springbok Dream Doctor. So yes, that's wonderful, and thank you very much for that. I know you also used to coach and guide us with Ironman, especially the one that the series that is hosted by Nelson Mandela Bay as well, in terms of the other work you do. And I know as well that in terms of your passion for rugby, even though you say you could not make it on the pitch, you do a lot of work and support your EP Kings, especially the developmental, and always avail yourself. And what would you say probably drives or is the passion behind not only practicing sports medicine, but for me as a person that have been close to you, it's more of the availability as well, where you can obviously you can't be at two places at once, but I've observed Conrad that there is this passion about developmental sport, about accessibility and being there to impact knowledge, whether actively as a physician or guiding some of us who are in the space. What would you say drives that for you?
Yeah, I don't know if there's one thing that drives it for me. I think it's just I'm fortunate that sports medicine has always been a passion, and I mean sport is a passion. So if I could do all the sports I'm working in, I would do them all, but I can't. But I think there's multiple facets to it. Number one, I'm really enjoying working with you, one of the older doctors now, working with the newer doctors coming through now, and just seeing their enthusiasm, and they make me enthusiastic again.
Mm,
But
mm,
then also, I think as you become older, you become sort of a guardian. So you've got a responsibility, and that means that, and for me, it goes a lot back to school sports, because that's where I feel we're not looking after them. The moment you're in a varsity team or any other team, then you are looked after, and there's people that are knowing what they should be doing. So I'm passionate about the young side, but also about the young amazing doctors coming through.
beautiful, beautiful. I'm lucky. I'm lucky to have you as our mentor, and you always open your arms. Even when I refer young doctors, you don't even know. I do know Inga that we hosted last week is also one of those that are under your wing in terms of guidance and support. So we appreciate that. Let's move on. Let's move on. How we phrased and we tried to do the topics for this month. We said. There is no one else who can talk about contact sport, especially injuries with contact sport, and obviously with predominance of those being the probably underlooked or if ignored concussions as a common and yet not paid attention to much when it comes to some of the contact sports as an example of injury. So where would you like to start by cautioning and maybe impacting or empowering people when it comes to contact sport and the essence of being mindful of caring or taking care of your health or your medical issues when it comes to contact sport?
I think if we look at contact sport, I find contact sport a lot easier, or acute injury, a lot easier than a chronic injury, because a chronic injury comes over time, where the
Okay.
acute injury is you see it happen, or they can tell you exactly, I heard something snap. But if we look at that as that acute injury, it can be from a plain contusion or a swollen limb from a knock, or it could be a fracture, or it could be a ligament, and then also that's where you've mentioned and a concussion. So I think acute injuries, if they occur and they don't go away quickly, then we know there's something we need to look further, even if it's from the head side through to a bone. So yeah, so I think it's a lot easier because we know something has happened and it's either going to get better, and if it doesn't get better quickly, then we need to look further.
Mm, mm, mm. And I think it's equally maybe a message that we can send across to say, if you are participating in a contact sport, be mindful that the minute you hear, you feel, you get to experience something, the best time to respond or to address it, it's when it has just happened, or around when you can remember the details thereof. Unlike, like you're saying, you wait and you report it later, when it's now chronic and you can't even be sure of the details. So I think I'm getting a sense that you are equally encouraging and maybe advising athletes as well to say, just be cautious that, should you experience or feel something, don't stay with it, report it or note it down, or just make sure that you don't keep it until it's too late.
Yes, and the good thing is there's a lot you can do on your own at home. So if your kid goes and twists his ankle, or you go for a run and you knock your toe, there's the basic things that you can do at home, which is, I know everybody knows the rice principle, but we can even go even to the price principle, where we protect it. So if it's sore, let's strap it or put it in a brace or go on crutches. Then we rest it, we ice it. Icing for me can be a good thing, but it can also be a bad thing, because some people ice it too long and then you burn your
Mm,
skin, and there's nerves and arteries and veins that can get damaged. So I would, as a just a normal rule of thumb, 5 minutes off, 1 minute after 5 minutes on, 1 minute off, five on,
mm.
one off. So 4 sessions of 5 minutes with a minute in between. So we know we're not causing harm, but we can help with that swelling. And then, it's compression. So light bandage, and then elevate it. Put the foot up while you watch TV, see how it goes, or the arm, and then see how it goes. And then obviously the next morning, if it's not better, you need to get extra help.
I like that you are even empowering us now to take the initial steps, and do something whilst you are still going to consult, or even whilst you're observing, as to how is it going to be progressing. And I think you've made it very simple. We are going to share with the viewers, in terms of Dr. B Talks, even post the session, and remind them what you meant by the price, so that at least they could always have something to refer with, in terms of ensuring that, they can look into that. You went a lot in rugby. I
Mm,
personally always say that's one sport, I took too long to understand. Um, Usually, some of us, we grew up observing football. Football, they look for
yeah,
a space and they play in the space. Rugby is the opposite. They get a ball, they go and go straight to others, and they want to get to be rambling there. So that's
yeah.
very hectic, and that's contact. But, now how do we, maybe first, in terms of advice, or are these contact, even with reference to rugby now, these injuries, especially your head and concussion, what can we advise people in terms of caution as they go and play this type of a sport? Just as a start to say,
Okay.
it's inevitable that you're going to bend down, you're going to
Yeah,
put your head there, but
yeah,
this is what, maybe before we come to the actual,
yes.
injuries themselves. What cautions
I
do you think are practical that we
yes.
can share with them?
I just think before we go there, we must remember that if you look at, I think it's our Dr. Tulani, yeah, who in the previous World Cup football took one of the other
Yes.
players off from another country who was concussed. So it doesn't only happen in rugby, it happens in football. We had Lungi Ngidi 2 weeks ago in the IPL, in the cricket, and went down, and he had a hyperextension of his neck. He went off with a concussion. So it can happen in any sport. So it's not just acute, and it's not just concussions, but all of it. But if you're going to look at concussion specific, number one is, I would start with our coaches, is coaching proper technique. If you're going to put
Okay.
your head in the wrong place, from a tackle point of view, from a scrum point of view, if you put it in the wrong place, somebody's going to knock you and you're going to get injured. So the more you put it in the right place, the less chances you're going to get of getting injured. Then if you go and you decide you actually want to play rugby, then you're going to do extra conditioning and things where you're going to say, listen, let's make my neck stronger. Let's work on more tackle technique. And, so that's the prevention side of it. And, and the conditioning goes with it. So if you are unfit, you're most probably going to put your head in the wrong place a lot easier. And then also, if you've had previous injuries and previous knocks, you need to take that into account, that you might take longer to get back, and we need to look after you longer.
And for me now, it's for those coaches that aspiring coaches and parents that do support their children with the training and support their kids with being competitive in sport, is that already now there's two things that we can take home. One, it's from a coaching point of view to just know how to play the sport or how to do certain tackles. And I think I like the wise way that saying just know the right places and how to position your head when you are doing some of these things. But the second one, it's also now something that as an athlete as well, I can be mindful of in terms of, you spoke about the strengthening, you spoke about ensuring that at least you do your part. So I think that's how we can then also make sure that when it comes to the preventative method or the preventative aspect, and obviously, I like as well that you were able to also remind us and relate to the occurrence must not only be limited or only be linked to just rugby. As you mentioned, even the other sporting codes that also had to do with the same diagnosis, but people would have expected it to be just linked to rugby. And we do appreciate that even in terms of the sports medicine relevance, we see now that the sports physicians are able to protect athletes, irrespective of the controversies and irrespective of the risks that are there from the other teams, from the spectators, but the appreciation of saying, you guys know that you would rather protect the athlete first, and we'll deal with the other issues that are regulatory or even perceptions. And I think that's one thing that we would like to take forward with our viewers as well. Now you have them
And
injured. They are all
can I
yours.
just on that, please share something that I learned this week. So I have a 15-year-old boy who's had recurrent injuries playing rugby, not concussions at all, but he plays 1, 2, and 3 for his school. And what happens now is there's an injury, and then he must come back, and he goes straight into the first team under 15A again. But he's not conditioned. But so I started asking Clint from SA Rugby, listen, I can't let this boy go play because I don't think he's ready to play.
Hmm.
And he actually, there's a law. So in South Africa in rugby, there is laws. So for a front rower of that age group, they need to have a preseason. If they don't, and a front rower, now if you don't know rugby, that's 1, 2, and 3. If they haven't been conditioned preseason, they are danger, and you as a doctor can actually lawfully prescribe him not to play until he's conditioned. So the law is also protecting us more and more in rugby, and I think all the other sports are getting a lot more, things out there where we know we are protected as doctors, but we are protecting our athletes.
Wow. I think that's also an important um, association, because for us here at Dr. B Talks, it's obviously appreciating that you are able to share that, especially confirming and reminding those that are already active in rugby that it's not a thumbs up issue, it's not a special issue, but it's already something that is there as a regulation to protect the athletes as well as protect the physicians. And I think for us, even if you are not in rugby, the fact that there is other sporting codes, including rugby, that will go to the extent of regulating the protection, it just goes without saying that you need to start taking that liberty of being preventative, proactive, and make sure that you respond if there is anything that you need to be reporting when it comes to injuries, even in other codes, even those that are still in rugby that don't have the level of exploring these other regulations. But the message is quite clear. We, from the physician point of view and the health point of view, are saying athletes should come first, and we should be able to protect them against preventable injuries if we can in our place. Thank you very much for that. And I think, and I hope our viewers have also picked that up. Please don't forget to drop your comments on the comment section. And please continue to just put your thumbs up, your hearts, your claps, just to show that you are still with us at Dr. B Talks. And this is yours truly, Dr. Luvuyo Bayeni, your host. And we are having our guest today, Dr. Konrad von Hagen, who comes a long way as my mentor when it comes to sports medicine issues. Thank you very much for once more for joining and on our simulcast broadcasting with Sowetan 10. They are now yours. They are injured. They are concussed. What has been your lessons, maybe? Also, any moments that you also want to share, especially those moments that you feel like, here, if everyone involved would have delayed for 1 second, the outcome would have been worse off. Just for people to understand and appreciate that role or that importance of those decisions of saying, yes, I stop, let me send to the doctor. Yes, I allow doctor come in. Yes, I give everything and the decision to the doctor. Just share with us and your experience and some moments that you think our viewers would equally benefit from.
I think number one, when it comes to concussion, is to realize that it is not you're not going to see a brain bleed on an MRI. You are not going to, it can be subtle symptoms. You don't have to have a direct knock to your head. You can fall and have a hyperextension or a whiplash type injury. That can give you a concussion. You can go in and you can rotate and flex or extend your neck. And so your brain is soft and it's in that hard case. So anything that makes it go forward and back can make it swell. So we must just know that you don't have to have a head knock to have a concussion. You don't have to have a loss of consciousness to have a concussion. The boy that comes home and says, yes, see, I'm not feeling well, I'm a bit nauseous now, and yes, that TV sounds loud. That's also a concussion. And there is so many guides, and you will know them, but you share them with everyone, is with the Box Smart and with SA Concussion on what is the symptom complex. And that is where the diagnosis comes from. Not an MRI or a fancy scan, it's a clinical diagnosis. So that is for me a very, very important message, is that we know, let's check this. There's 22 symptoms we check. And if you're positive, then you classify as a concussion. And then you fall into a protocol. And in schoolboy rugby, that's 21 days minimum. In professional rugby, we can bring it back to less, but because they've had brain tests that's test before, so we know they return quicker, so they can return quicker because they have got an expert medical team looking after them. But not the case in schoolboy rugby, cricket, everything, So we must remember that if they come with funny symptoms, start thinking maybe there's something. And the problem is, if we miss that, then we sit with a kid that gets a second one. And the bad thing is there's actually a thing called second impact syndrome, which fortunately I've never seen, but it's in the notes, is that if you get a second knock and you're not ready, you can actually die there. It's a response that happens. So we can't take chances with it. But the one that's more bothering is the kid that gets 3 a year and they don't recognize it, and now it's matric exams and they can't focus. So I had to write letters to the department to ask them for extra time, because these kids have now got a chronic condition, and it's because we didn't manage them right from the beginning.
And equally so, it means the same will apply to an adult who now cannot function optimally as they would, even in terms of their daily life and duties, and it's something that obviously means taking as a lesson, when we have access to the 22 symptoms, I think we would be more comforted that the parent or whoever is available to assist this athlete, you would rather ask them every time they come back from playing, rather over question them, instead of just missing the opportunity. Because it's something like you said, it's something that can be done over dinner. You are talking about the game they played, and then you just go through, and you will be able to have a sense. And I like the
Yeah.
fact that you were emphasizing and equally empowering us to say, especially when it comes to concussion, don't sit and say, I wish I had access to a scan. I wish I could afford a scan. Whereas you could just simply be looking and helping with just those questions in terms of having a sense and even referring or going for consult instead of saying, I don't have money for a scan or I can't afford to go for investigations thereof.
Yeah. But Luvuyo, as you were saying, in like cases that I know, so even grown-ups. So I saw a gentleman who came for a medical for his insurance, but he was in a car accident a few months ago, and he had all the tests done and the MRIs and all those things. But when he got to me, he was unsteady, and I said, "What's going on?" And I started to doing a concussion evaluation, and he was working in a financial environment where he's been so slow and he doesn't even really know he's so slow. Now, and I told him, listen, man, let me just get all your scans and see that's been done. And they were all normal, but he had a chronic, longer concussion. And the problem there is that he didn't even know it because he was just going on like normal. And one of the little stupid questions in that symptoms is, do you feel like you're in a fog? And if you've ever been in a concussion, the moment that fog's lifted, you think, where have I been? So that's where I ask the kids, are you back? They say, oh, yes, I'm back. And the problem with him is he went back into a high pressure environment and these symptoms just stayed on longer and longer and longer. So you are 100% right. This is not just for kids. This is for every one of us that's got normal jobs and we need to go on and we need to do this and we need to do that. But something's not right. And sometimes even our families don't tell us, but you see, you're not yourself now.
Wow. Thank you. Now I'm
Sorry.
just trying to make sure that our viewers get to also understand and appreciate that we continue to empower. And ours is to make sure that from tomorrow onwards, there would be a different approach in terms of how we do things, how we look, and how we support. Because I think we want to give the power back to those that are supporting athletes and not just only end up by saying, I'm going to go and cheer. I'm just going to go and be there. But we want them to feel that they are now empowered to really embrace the support that they are giving, in that they will be able to share and raise some of these conversations we are having. Importantly, so to even advise the athletes themselves that when you've got time, just go and look at those 22 questions. When you've got time, just go and look at the conversation that Dr. B talks, so that people can understand that ours is to make sure that we empower them and we want to protect them. And as we know, for us as physicians, we would rather be bombarded with people that want us to prevent and help them prevent than when they come afterwards. So when we have these conversations, it's just to make sure that we can empower our athletes to be able to do much better and be preventative in their approach. And thank you so much for sharing that. And also the relation to say adult life behavior, look at how these injuries or almost injuries could have affected your performance, just to have a sense as to what is happening. Apart from the concussion that you also indicated, it's not purely a rugby prone only. It can happen even with other sports that are there. When people just say, I'm afraid of playing contact sport because it's got so many injuries, how can you please correct that myth? Because even if I'm running, I might think that I'm not in a contact sport, but yet the injury profile might equally be more or less the same, or even for other people looking at what type of an athlete they are, it could be different. So how can we advise or maybe clear the myth, if we can, for those that say, I'll rather stay away from
Yeah.
contact sport because that by its own makes us prone to injuries?
So obviously your mom says no, my kid's never going to play rugby because look at all these bad injuries. But if you go and look at, you know, if you are fit, well conditioned, if you know the rules of the game, if you look at your techniques, all of that, your chances of getting hit off your bike driving to school is, I don't know. I don't know the exact figures, but if you look at it, it's still contact sports is amazing, and contact sports is not for everyone. So if you don't want to tackle people and want people to run into you, you don't have to do it. But if you like it, there's ways to keep it safe, and there's ways,
Okay.
and in South Africa, in World Rugby, if you just talk rugby now, people are fighting hard to make the game safe. From how high you can tackle, from how you scrum, everything. So um, my son played rugby, and he's now a fifth year medical student. So he wasn't his game, but he still had fun doing it, and but he did it safe. Yeah,
Mm,
as
mm.
safe as you can. Anything can happen. That's the reality. But anything can happen while you're in a shopping center and you trip over something.
So I think you are trying to tell us that let us not use injury profile as an excuse to make people not play certain sports. And I think the other way you have also been I deal with it is to say when you're playing sport, there are things that becomes a must: fitness, trainings, techniques, just your psyche on the sport, irrespective of which sport it is, so that at least you know that the risk of injuries are minimized by just that responsibility on your part of making sure. There is Shares there who is also saying that this is quite interesting. I once witnessed my brother falling off his bicycle and sustained a big abrasion on his head and the face and started being confused. And we laughed as we were still young. And growing up, he began being a slow learner. So now I understand it could have been a concussion, but he's okay though.
Mm. Absolutely.
Those
That
those
is
yes.
exactly. Thank you for that. Yeah.
And I think, like you had referred to, some of the issues that are day-to-day activities that we should have observed, that there is a change in those. It also talks to what we're saying, that irrespective of a scan, but just by mere paying attention to those. Thank you very much for that comment, and we really do appreciate it. And time flies. It's left with 15 minutes now. And yes, so to all the parents out there and anyone who is still supporting athletes, please be mindful that when it comes to prevention of injuries, it is not only about the type of the sport, but also the preparedness and the efforts that the athlete puts into the game. In terms of preparedness, in terms of the fitness, in terms of the conditioning, and just understanding the appropriate techniques. So those who used to be like me and say, don't go because it's a contact sport, we have been wrong. It's got nothing to do with that. But importantly, the definition of contact sports obviously will talk to how the game is played, which means they do go and tackle. So don't push your child if he is not really into enjoying the tackling part, because that's a fundamental part of the game that they must enjoy being in a contact sport. So don't just be that parent or that person who says, no, you can do this. Your friends are playing now, you must also play. Whereas the heart and the mind of the child is not into that sport. Let's also now move on to say, now I know that when it comes to one of the biggest things that you probably have to deal with is now having to ask and share with this athlete that I would like you to be off for some time. And I think this is the part that no physician probably wants to be in. Because when we deal with athletes, we equally understand that they that is their also future profession and career, and some of them are at prime at the time, and now they have been brought to you because of this injury, and you now have to. I don't want to say better of bad news, but you have to now have this conversation, and I'm sure that's one of the issues that especially with you also having that own background of being a sportsman, though you couldn't go as far, but yeah.
You know, I think as I got older, it became a lot easier. You know, as a 30-year-old doctor, it's difficult to tell a 28-year-old, you're not going to play rugby for 9 months now or for so long or do
You.
whatever sport. So it became easier. But the way I found it to be more supportive is to tell my athlete that, listen, you've got this injury now. We cannot do anything about it. It's a reality. Let's give you a timeline that we're going to work on. So we give you goals and you need to work with that goals. But now you've also got a time to work on that stiff ankle that we didn't have a time for, or work on the range of movement in your shoulder because we didn't have time for because you're in competition all the time. So you use that off time not only to fix the injury, but it's also there to fix other problems. And even if you want then to tell them, listen, do you want to go to speak to somebody about your mental side of the game? And that let's work on that time because we're not going to get that time again. When you're right, you're back in competition, and then it is weeks and months on end that you don't have that opportunity.
So it's I always want to be opportunistic and see what is it that I can apply with my life on certain things. But I'm getting it now to be saying it's sort of trying to present this difficult situation with another opportunity of a positive outcome, sort of some
Absolutely.
a positive reinforcement of some sort. And like you're saying, you're saying you can do better with this, but you're not having enough time. So now improve on it whilst you have this that is keeping you away. And I think for me, it's something that I think I would see how I fit it into my life. But as you were saying it, I was looking at it to say most often than not, even in life, we get to have drawbacks because we are only looking at the injury, the time off. Whereas that opportunity or that moment could be creating opportunity for something else that we could be better at whilst we are still recovering from that injury. So I think I'm sold with that approach, and not only from a sport point of view or an injury point of view. It's just for me, I'm taking it even now to the level of just life, how we can approach it as we meet hurdles, as we go along, as we grow in life. So I think that's one of the best for me in terms of approaching it. And you are right to say every athlete would like an opportunity to improve in their game, whether it's a pass, whether it's like you're saying, it's the speed or whatever. So as much as the injury is taking them away from playing, when you are able to raise those other elements to say, but now we can work on this and that for you to excel in, it's easier for them to see the opportunity instead of just being focusing on being even depressed, for a lack of a better word, from the time off from the competitive sport. And I like you said, with age and time, it becomes a bit easier to be able to look at it that way. And I was even worried for you when you started by even expressing an example of just sometimes it's a 2-year difference, and you are talking being in your profession and this person is suffering in their own career or profession. But and I hope even the young physicians that are listening and those that are involved in sport as healthcare workers, they are able to then take that home and be able to use it when we move forward. Now, I also don't want us to be seen as if we just gonna look at the dull moments, because I also know that even with the practice, there are moments that we feel proud of ourselves that, initially when I saw that, especially when you are at the game yourself, there are moments that when you see the tackle, when you were able to witness that impact, you even feel like, yo, we that was a hard one. And but when you are in the space of being the therapist or the physician in charge, you even see moments of even seeing discipline growth, you see attitude growth, you see all these other elements that come now as a package. How have those moments been part of your practice, and maybe also your experiences as you've been dealing with injuries? Because like I'm saying, I would like us to be able to be understood that it's not only the dull moments that we come across when it comes to dealing with sports injuries.
Yeah. So I went to England the moment I finished, and then I did a 2 year stint there. And I spent 6 months in casualty working under a guy called, they're specialists in surgery and so on, are called Misters, not doctors. So it's a Mr. Lehman. And he asked me what I wanted to do with my life, and I explained to him what my goal is. And then he said, remember, if you, a sports physician, you are a specialist in sport and not an enthusiast. So that has taken away a lot of my normal enjoyment for. So if we scored a try, I don't even see if we scored a try. I'm watching who's the last guy getting up, because that's my job. So it's changed the way I'm thinking. So there will not be that immediate. So if we win a World Cup or something, I'm not running around and being. Slowly taking it in, but because that was not my job, is to win. My job was to look after the players. But I had a recent one. Parents called me and asked if I could see their son, but that's in they. But he was just home for a week, and I was in another town. I said yes, but I can see him there, and they said no, you'll bring him through, and he's a top swimmer, but another university up north, and suddenly he's not performing. And I said, okay, let's talk about it. And it was a long consultation. And I said, okay, we're going to do all the blood tests and the lung tests, but I don't think this is what it's about. I think, and I told them in front of him, I think you as parents need to leave him now alone. No, he's a grown man. He must decide if he wants to swim or doesn't want to swim. And then, yeah, and he won out the African games, and he won his event. Coming from, and that is satisfying, knowing that you're having that hard conversation, that reality check, and say, decide, is this what you want to do or not want to do? Because there's nothing keeping you. No, and your parents need. I'm not speaking to your parents anymore. I'm speaking to you. So I think, yeah, it helps being an older doctor, but it's a good way for our younger doctors and for our parents to know where do we go, but that is satisfying.
Wow. Yeah, no, I think I can tell people that I'm your product, you're my mentor. Because whenever I do my when I used to do my boxing matches,
Yeah.
exactly what you're saying. The interest is as much as we're watching the game, but we're not so much into the scoring, who's winning, who's not. We just want to know. And we've even introduced in the boxing space the punching index. You need to know exactly how repeated was this guy hit in the head and what could be the after effects. So I agree with you that we might be there as team doctors, but the cheering part comes later, maybe in the change room when we are sure that all the athletes are fine. Now we can start enjoying. So, and I think that's one thing that it's also significant to understand when it comes to the field as well. But I also like the fact that we get the moments where we say, let's stop the physical, let's stop the exercise, let's stop the injuries, but we can see that we need to spend a lot of time conversing, talking, motivating, just getting that inner child out to say, what is it that you want to do? And get the athletes to be ready to make sure that at least they can go all out and perform. And sometimes through those sessions, that's when other people will find that they are even surprised that, but this athlete was out on injured, but the way, the energy, the excitement, the levels, it's like he just didn't come back from injury. And because of the moments that are there. And like you said, those are the exciting moments to see that this person now is more driven and has got more enthusiasm and energy to want to pursue their career, even to come back with having achieved as well. So yes, there it is. Please do understand that we, as much as we deal with the injuries, but this practice itself does give us an opportunity to support the athletes in terms of reaching out to their fullest potential, even including their mental state, as well as their drive to remain in the sport. And obviously, there would obviously be those that will come in and say, actually, after having had this conversation with Dr. Konrad, I think I've done pretty well in sport and I want to quit now and just say, because I've realized that I've given my all and my passion, and now I think I want to pursue other things. So because those are issues that, and for us, it's just about that importance of the person realizing where they want to stand, because if you miss that, they may continue, but they are no longer there. And that's when they become even prone to more injuries, because all that drive and that thing of caring for self, putting self first and preparing adequately would just die out because they are no longer in the space as well. So it goes a long way. Let's make sure that we do create those opportunities for people to just reflect if indeed they are still interested and still want to be in the space. Once more, we are still on DrBTalks. It is now left with 10 minutes before we close the session. Please continue to send all your comments on the comment section, and also continue to follow us and make sure that you don't miss an opportunity to ask our good doctor in terms of that. And then also, of course, I also would like to take an opportunity now. You did share with me that we missed to have coffee. You were around and you were doing duties for golf.
Okay.
And how does that switch? I would call it switch, because you have been and would obviously brand you as into the contact sports physician specialist, if I can use that word. And now you come and watch me hit the ball, and how does that
I
switch?
think that's what I told you. The acute medicine is a lot easier because you can see that's broken, let's fix it. Where if you know a pro golfer who's got a left wrist that's a problem and a little bit on the back, but they have to continue because they are here to play a major tournament that's $1 million+ online. How do you keep them going until they can get further rest or help? Because they're not broken, they must need to get through. So that's quite a challenge, and it's not. I mean, a golf week for me will start Monday at 7 o'clock and finish at Sunday at 5, and evenings will go till 6, 7. So it's a tough week, but it's not a tough week in the amount of people you see, but it's constantly, people getting sick, but they still need to continue. People now suddenly have a lower back problem, but you need to get them through. Sometimes you can't, but most of the time you can make a plan, and I think that comes with what we were taught is how are we going to help them with a legal way to keep on the pitch.
Wow. Yes,
And
indeed.
the nice thing with the golf is you go to Leopard's Creek and you go to Sun City and you go to all these nice places now.
Yeah, no, I don't just take you to some stadium in Sweden.
I've been there and I've loved it now.
So now it's levels. Now you just enjoy the
Yeah,
scenery there.
yeah.
And making sure that at least there's some breathing, some fresh air. No,
And I,
that's interesting to also note. And maybe let me also use this opportunity to even encourage and motivate the young physicians that will be also intending to pursue sports medicine, that indeed the opportunities are there, and like we were saying, it should not only be seen as just to focusing on your contact sports only. Every sport needs a physician, and the opportunities are there. So it will also give them some light, especially the young ones. Now, when you spoke about all these places where you go for golf as a physician, the young ones would love to be there at Sun City. So it's exciting to also show and see that in terms of the career progression and the opportunities that are there. within the sports physician platform, that there is those issues. And maybe I'm left with two issues that I would like to pose to you. This one now is coming from a mentee point of view. To just say, what's your reflection on the journey that has been there for Konrad when it comes to sports medicine?
Sure. It's a very loaded question. Yeah. my life motto is Festina Lente, and it's a Latin, and if you translate it, it's a very bad translation, but it's haste slowly. So my career has been not a fast career, it's been a slow career, but I think staying in the moment while you're progressing, you won't even know you progress until you think, okay, look where I'm now, and look where I'm now. But I think my biggest takings of it all is that if I work at a stadium, I know I will greet every paramedic that works with me. I will greet every doctor that works with me. Now, I'll know who cleans my room. I will know. So it's staying in the moment while you're doing what you're doing. So it's more caring for everyone around you, and getting to know your players and so on. So that same Mr. Lehman asked me, how are you going to still be interested in medicine when you're older? And I thought that was the most stupid thing you would ever ask, because obviously I will. It's exciting. And he said, no, now I'm looking back and I'm thinking the things that are interesting. Because most of the time, if you walk in within 3-4 questions, I know what's going on and I know what we're going to do. But how do I keep it nice for me and nice for the patient is you actually get to know them, so get to know their story. You get to understand a lot more by doing that. So I think medicine, yes, is medicine, but there's a bigger thing, and I think you know exactly what I'm talking about, because that's what you are about. Yeah.
Thank you, my mentor. Thank you, my boss. um, I always reflect on that moment and the opportunities we got of 2010 Football World Cup, and for me it's yes, I know as a country and as a continent, we embrace that opportunity to have the World Cup hosted in Africa for the first time. And I always reflect and say, even more so, for those of us who had an opportunity to be part of the team, and also those of us who had an opportunity to just be there on the touchlines. But I also do reflect and know that people don't understand that for those of you who were in charge, it was just not that easy. And you are always having to be on your toes. You always had to catch us and call us in early, just to even play videos of some of the drills, just to refresh us and our responsibility. How would you say, or how would you reflect on that experience and opportunity of being in charge of the medical for the World Cup and such a huge showcase of sporting event? Yes, for the rugby you were there, but for the team, and you were working with the team. But now you were given in sort of delegated responsibilities from FIFA Medical to say, in Nelson Mandela, we put all our trust on your shoulders when it comes to medical issues.
It gave me lots of gray hairs, because I was supposed to be the doctor in the medical room. That was my job. And then getting closer to it, our VMO then moved, that's venue medical officer, he moved and got a head position at Tux, so he couldn't do it anymore. So I had to have an interview at the airport with them and saying, "Are you able to do this?" But I said, "Yes, we've got a few weeks left, and there's a lot of work." So they said, "But it's fine. You go to every meeting you can." And so I sat through a lot of meetings, but I learned a lot, not from the medical side, from the day to day. And the amazing thing what the World Cup brought us, it brought us events law. So now we know if I'm having a 10-kilometer race, I must have this and this in place to keep it safe. If I'm going to have 90,000 spectators, I need that and that to keep the spectators safe. So I learned so much, but I must say, during some days were I never. They gave you a BlackBerry when the day you get there. They give you a BlackBerry. They give you a car, a Tucson, a Hyundai Tucson. I had that, and then you've got a match day -1 suit, match day suit, and all this. And for 7 weeks, I worked in the stadium. But that BlackBerry is the one number that, and it rang all the time. So the first thing I did after that is I got rid of anything that sounded like a BlackBerry ringtone, because that is like, there's trouble.
Wow. I used to not envy you because I knew how much demand there was to the role and the responsibility as well. And like you're saying, even outside the medical issue, because you were responsible for being part of hosting this event, which did not come easy. So we do appreciate, and those are the moments that we will always cherish. And of course, for me, it was a moment of how I got to meet the big doctor, and he has been holding my hand since then, on especially on sports activity issues and sports medicine issues. We are now left with just 5 minutes. Yeah. And let's also remind our viewers out there, you can continue to follow us on DrBTalks page, as well as Sowetan, and on YouTube channels for those two. I see Thembi Magwa is a friend of mine in PE, that he is with us and has been on the show. Thank you very much for that support as well. And as we continue, now I would just like to, I'm sure you are probably busy though, but how do people get to access you?
Me.
In between your travel, do you still consult if I wake up tomorrow and say I'm looking for a sports physician?
No, I
I
do.
know
I
you're
do.
busy.
No, I
I
do.
know
And
you are very busy.
so my one of my patients told me the other day, his wife said, "But your doctor's never here." He said, "No, but I just watch where the sporting fixtures are. Then I know if he's here or not." so, so I'm fortunate that I've got the youngsters coming through. So I've got a young sports doctor working with me, very experienced, and then good other doctors. So when I'm not there, there's always somebody caring. But yes, whenever I'm in town, I am at my office in Cape Road, and I enjoy it. And like I'll know tomorrow, after this weekend where rugby was back after the bad weather here, it will be a busy day at office. Yeah.
Yes. No, that's good. Any parting words from you before I?
I just think if there's ever anyone that wants some advice, you're more than welcome to give them my details, no? And I'll assist. Like always, I said, part of what we do is educating, and that's the most important part for me. Is that there's so much we can do for ourselves before we end up with the doctors, and the more we know as parents and as athletes and as things, the more we can do for ourselves and know where we're at. And there's so many platforms out there where you can get the advice. It's just getting the right ones and not the gimmicky ones where you get the wrong advice.
Most definitely. Thank you very much, my big boss. And definitely we would post your details and your practice address so that those who would like to get in touch with you will definitely do that. And yes, at DrBTalks, we also create that platform so that people can be able to know where to go, especially having learned or picked up something from the conversation. So we really would like to thank you very much for making time for us. And And thank you very much for all the information that you have shared with us. It's been a great conversation. It is now 59:42. It has been the whole
Before I
hour.
go, I just want to say thank you for the opportunity, and I'm very proud of you. Keep on doing what you're doing.
Now you bring out the soft high side of me. You're gonna make me cry.
Yes.
No, thank you very much, and thank you very much. And there is already one of our viewers shares is saying that they will definitely contact you, doctor. They have got a nephew who is also a rugby player, and they would like to see how they can benefit from your services, and will definitely be contacting you. So thank you very much, and it has been an honor for me. I really appreciate to also have got to do say that I'm always humbled to have been part of the team and the list of people that you continue to mentor and support in terms of our growth as the young generation. And it's always a pleasure to always have conversation with you. Actually, now this is the longest since you've been busy with rugby. You've always promised me coffee, coffee, coffee.
I'm waiting for you.
So
I'm waiting
at least
for you.
you're waiting for me. No, thank you. Yes.
You're the big man that's all over now. So.
Oh, really? No. All right. Now, thank you very much, Konrad, for all the time and the conversation and the knowledge that you have imparted with us. And we really would like to wish you all the best and in your endeavors, and especially with you impacting some knowledge on the young ones that are still coming under your care. And yes, indeed, me and you, we know that we are not putting too much pressure on him, but we are also looking forward to having the likes of Inga joining your ranks and being the safe physicians that we know and we are grooming them to be. So we do appreciate that you are impacting that knowledge, and we continue to see your work even outside the athlete or the actual physical physician scope. So yes, thank you very much to the viewers again, and thanks to my team for pulling up the support as well. We are going to meet now next week as we continue with our topics, where we are focusing on issues that relate to sport and exercise medicine. And always a pleasure. Continue to drop your comments on the comment section, and we'll do our endeavors to make sure that we do keep in touch and contact you and update you on all those. Continue to invite as many people to follow DrBTalks Sowetan, as well as our subscription for our YouTube channels. And today it has been lovely to having you, and it is exactly now 1 hour 2 minutes of our time. And I always say I appreciate that I borrow an hour of your time and would not want to mess our relationship and go beyond that. So thank you very much for borrowing us 2 minutes of your time as an added time to our hour. And that is it for the night. And thank you very much for always tuning in to DrBTalks every Sunday at 1800 hours up until 1900 hours. We appreciate your support. And that's it. Have a lovely evening and have a blessed week. And we'll meet next week, same time, same place. Thank you.
Bye-bye.